mesothelioma affects the lining of the lungs and chest cavity, and finding surgeons and oncologists who specialize specifically in this type of the disease is critical for getting optimal care. While some doctors treat multiple mesothelioma types, others focus primarily on pleural disease with particular surgical or medical expertise. Today, I want to tell you about some of the leading pleural mesothelioma surgeons and medical oncologists in the United States, what approaches they specialize in, and how their expertise might benefit your specific situation. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice, but knowing the top pleural mesothelioma specialists helps you access expert care. Now, this list is not going to be comprehensive, but let's start with leading thoracic surgeons who do specialize in pleural mesothelioma surgery. Dr. David Sugarbaker at Baylor College of Medicine is arguably the most experienced mesothelioma surgeon in the world. He's performed over 2,000 mesothelioma operations during his career, and he's been a pioneer in developing and refining surgical techniques. Dr. Sugarbaker initially championed extrapleural pneumonectomy for this disease, but he's evolved his practice toward pleurectomy decortication as evidence has shown better outcomes with lung-sparing approaches. He emphasizes multimodal treatment, combining surgery with chemotherapy and sometimes radiation. His experience spans decades and includes training many of the best mesothelioma surgeons out there. Dr. Raja Flores at Mount Sinai Hospital in New York is the director of thoracic surgery there and a leading voice in pleural mesothelioma treatment. He specializes in pleurectomy decortication and extended pleurectomy decortication. These are lung-sparing procedures that remove the pleura and visible tumors while preserving the lung. Dr. Flores has published extensively on surgical outcomes and the importance of patient selection. He's known for careful patient evaluation to determine who will actually benefit from surgery versus who should pursue non-surgical treatment. His approach is evidence-based, and he's been influential in moving the field in the right direction. Now, before I go on, I'm going to take a break here to ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comment section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. Moving on, Dr. Rafael Bueno at Brigham and Women's Hospital in Boston leads one of the oldest and most respected mesothelioma programs in the country. Brigham and Women's has been treating mesothelioma patients since the 1980s and has extensive outcome data showing their results. Dr. Bueno and his team offer both surgical and non-surgical approaches, and they are involved in cutting-edge research, including gene therapy and targeted treatments. The Brigham program is known for its comprehensive evaluation and honest discussions about whether surgery will actually benefit individual patients. Dr. Prasad Adesumilli at Memorial Sloan Kettering Cancer Center combines surgical expertise with innovative research. He performs pleurectomy decortication and is developing novel approaches, including intraoperative heated chemotherapy and immunotherapy. Dr. Adesumilli's research on CAR T-cell therapy, which is genetically modified immune cells that target mesothelioma, represents potentially transformative treatment. While still investigational, his work does offer hope for the future. Dr. Joseph Friedberg is the thoracic surgeon-in-chief at Temple University Health System and co-director of the Temple Health Mesothelioma and Pleural Disease Program. That's in Philadelphia. His clinical interests include mesothelioma and other disorders of the pleura, as well as the treatment of advanced lung cancer and other complex thoracic malignancies. Dr. Friedberg is known for his willingness to try innovative approaches and for his compassionate, patient-centered care. He's published extensively on surgical outcomes and novel treatment combinations. Dr. Valerie Rusch at Memorial Sloan Kettering is a pioneering thoracic surgeon with decades of mesothelioma experience. While she focuses more on lung cancer now, her contributions to mesothelioma surgery and research have been foundational. When it comes to medical oncology, the doctors who manage chemotherapy, immunotherapy, and non-surgical treatment, several specialists stand out. Dr. Hetty Kindler at University of Chicago Medicine is one of the most respected mesothelioma medical oncologists in the world. She was a principal investigator for the Checkmate 743 trial that established nivolumab plus ipilimumab as a first-line treatment option. She's led or contributed to numerous clinical trials that have advanced mesothelioma treatment. Her expertise in immunotherapy and novel agents has made University of Chicago a top destination for the medical management of pleural mesothelioma. Dr. Ann Tsao at MD Anderson Cancer Center has been instrumental in developing treatment guidelines for the disease. She is involved in clinical trials testing new drug combinations and targeted therapies, and her research has helped establish current standard chemotherapy regimens. She also continues to investigate novel approaches. Medical and surgical expertise is what's important in all of these treatments. Other options and examples are Dr. Harvey Pass, who's professor of thoracic oncology in the Department of Cardiothoracic Surgery at NYU Langone Health. He's been treating and researching mesothelioma for over 30 years, and he's published hundreds of papers on mesothelioma biology, diagnosis, and treatment. Dr. Pass's research has contributed to understanding mesothelioma at the molecular level and identifying potential therapeutic targets. His clinical expertise spans both surgical and medical approaches. Finally, Dr. Andrea Wolf is director of the New York Mesothelioma Program at the Mount Sinai Health System, which provides comprehensive, multidisciplinary clinical care for patients with suspected or diagnosed malignant pleural mesothelioma. She and her team at the New York Mesothelioma Program have received numerous awards for the excellence of their cancer care. She's also co-editor of the third edition of Dr. Sugarbaker's book titled Adult Chest Surgery, and has herself published extensively on pleural mesothelioma and lung cancer. Dr. Wolf specializes in general thoracic surgery and has expertise in robotic and minimally invasive techniques, including video-assisted thoracic and laparoscopic surgery. What makes these and other doctors top tier for pleural mesothelioma specifically? They see high volumes of pleural mesothelioma patients, dozens to hundreds annually. They're involved in research advancing treatment, clinical trials, surgical technique development, or basic science. They have measurable outcomes data showing their results. They work in multidisciplinary teams where surgeons, medical oncologists, radiologists, and pathologists all collaborate on providing care for patients with mesothelioma. They all stay current on rapidly evolving treatment options, including new immunotherapy combinations and the latest clinical trials. How do you choose between these specialists? Consider logistics. Which centers are accessible to you? Consider philosophy. Some surgeons are more aggressive, while others are more selective about surgical candidates. Consider research interests. If you're interested in treatment using novel therapies or in being involved in a clinical trial, choose specialists who are actively involved in that research. Most importantly, Consult with multiple specialists if possible. Hearing different expert perspectives helps you make informed decisions. What if you can't access these top-tier specialists? Many have trained surgeons and oncologists who now practice at other centers across the country, and a call to their office will likely yield a referral to one they respect who is closer geographically to you. Also, telemedicine consultations are increasingly available. While the specialist can't perform surgery remotely, they can review your records and provide recommendations to your local team. Remember that even with the best specialists, pleural mesothelioma remains very challenging to treat. But expert care gives you the best possible chance at optimal outcomes and access to cutting-edge treatments. To review, top pleural mesothelioma surgeons work at cancer centers that offer cutting-edge treatment in thoracic diseases and mesothelioma. They have high case volumes, research involvement, and proven outcomes. Consider consulting multiple specialists for different perspectives on your treatment options. You can visit mesothelioma.net for more detailed information about pleural mesothelioma specialists across the country, or call 1-800-692-8608 or use the live chat feature to speak to one of our patient advocates. As for me, remember to post questions below, and I'll see you next time.